This is a quick pathology quiz with 5 cases to diagnose. Answers will be at the end of the video, with links to the pathology mini tutorials. The first case is a male of 50 with a solitary 10mm pink nodule on the lower leg. What is it? Here is a higher power view. This is the biopsy stained with PAS, or periodic acid Schiff. Case number 2 is a female of 12 with a painful lesion on the foot. What is it? Here is a higher power view. And the biopsy here has been stained with floxine tartrazine, a rather pretty stain. Case number 3 is a female of 40 with skin-coloured papules on the eyelids. What are they? Case number 4 is a female of 12 with a warty lesion on the toe. What is it? Here is a higher power view. Case number 5 is a female of 18 with an itchy rash between the fingers. This is a biopsy of the lesion. Here is a higher power view of the significant part of the lesion. Case number 1 is a clear cell acanthoma. Here you can see the abrupt transition from the clear cell part of the lesion to the adjacent skin. And this is the clear cell acanthoma stained with PAS, and the lesion is clear cell because of the abundant glycogen, which stains positively with PAS, and it stains magenta. Case number 2 is a deep palmoplantar wart, also known as a myomecia. And the very pretty floxine tartrazine stain stains the viral inclusion bodies orange. Case number 3 is a syringoma. Case number 4 is an angiokeratoma of Mibelli, named after the person who described the lesion and not the location of the lesion. Case number 5 is scabies. And here you can see the mite in its burrow.